Good morning, everybody. Friday, 9:30. A little coffee, a little honey in it. I'm doing my own experiment because somebody at the farmer's market told me that they take honey every morning to help with allergies, and it seems to actually work, at least so far. I'm not coughing and sniffling as much. I've been doing this for about a week and a half. Although I just cleared my throat, sorry. Okay, so we're going to talk about Nigella sativa, which is known as black cumin oil or black seed oil, and the health benefits. A friend of mine told me about this 6 weeks or so ago, and I've been taking this just once a day for about 4 weeks. One of the benefits is help with hypertension. Of course, my blood pressure thing's been out of control for a long, long time. Hey, Eileen. Hey, Linda. Sarah. And so I got looking at this after he told me that he took this, and I can't remember what his issue was. I'm 59, he's 38, so I don't think his is, quite as horrifying as the problems I have with blood pressure, but I thought it was worth a shot. And then I got looking up the health benefits of Nigella sativa. And so I wanted to share that with you because it's kind of amazing. So my little graphic I put up, could this help you with all these different health issues? And I found a couple of articles, one of them from 2019 through the NIH, about all the health benefits based on actually prospective research. Hey, Linda. So this isn't all based on conjecture and all that, but this plant has been around for quite a while. So if you look at the history of this, so we're talking about black seed oil, or my bottle says black cumin oil. It's a plant-based remedy that's been used for a long time. It was mentioned way back 2,000 years ago by Hippocrates, and it was called, let me look this up. Back then, it was called, I got to figure it out. I got to find it because it's a specific name. It almost sounds like melatonin, but that's not what it is. Okay, Melanthon by Hippocrates and Dioscorides, traditional remedies that go back 2,000 years at least. So a long history of folklore usage in the Indian and Arabian civilization, which is probably why I'd never heard of this until this guy mentioned it to me. So I got looking, and all of the research has been done in the Middle East and in India. So what they've found, now that we can actually sort of study all this stuff, is that these are the following therapeutic potentials. Okay, so and once again, that FDA disclaimer, these statements have not been evaluated by the FDA, and I'm not saying that they're going to cure or treat anything, but there is clinical evidence that they may help. Okay, so really, they've been used for a variety of health conditions over the last 2,000 years, pertaining to the respiratory system, such as asthma, digestive tract, celiac disease, and gluten insensitivity, kidney and liver function, the cardiovascular system, and immune support, as well as just for general well-being. People claim to feel better because they're doing this. So the therapeutic potentials include anti-cancer activity. There's been some antimicrobial activity, so analgesic for chronic pain, antipyretic for fevers, contraceptive and anti-infertility, as well as an oxygen species, the reactive kind, so oxidative stress reduction. It's been used for an antitussive to suppress cough, an anti-inflammatory, and an antioxidant. Okay, so that's all those things that we talk about with chronic disease. Okay, so how safe is it? Okay, so I'm just going to tell you the safety parameters, really. So, so we're talking about this is a healthy volunteer study of administration of black seed oil to a dose of 0.7 grams of seeds. And I take, so 0.7, that'd be 700 milligrams. I take 500 milligrams a day. No notable liver, kidney, or gastrointestinal side effects. Reasonable kidney and liver safety parameters in patients with type 2 diabetes. No alteration of platelet or white blood cell count. They did another study on 39 obese men who had central obesity using 3 grams a day for 3 months with no detectable side effects. So they've looked at lab studies, they've looked at all kinds of stuff regarding administration of this supplement with no alterations of normal functions or bad problems or lab changes, etc. So this is based on these 2 studies. One of them has 111 references and the other one has 151 references. I didn't look at every one of them, of course, but most of these studies and these clinical trials have been done, again, in the Middle East and India. So nobody's doing this in the United States, although I did find both these articles on the National Institute of Health. Okay, so they've been used seasonal allergic rhinitis patients, and I don't really have rhinitis, but certainly seasonal allergies, thanks to living in Oklahoma for 10 years. But no adverse effects at a dose of 250 milligrams a day for 2 weeks. There was some, if they're using nasal drops of this, some dryness of the nose, that kind of thing. Okay, we've talked about, so that's just kind of simple stuff. Metabolic syndrome we've talked about before. I did that 4-part series based on cholesterol and statins, and one of the things we talked about was the fact that statins actually kind of induce a trend toward metabolic syndrome, which, if you remember, is kind of a cluster of conditions. So obesity, insulin resistance, so hemoglobin A1C elevation from 5.7 to 6.4. And once you hit 6.5, you're a type 2 diabetic. Also is dyslipidemia, so abnormal cholesterol levels, and we spent a ton of time talking about cholesterol and its relation to heart disease, and then high blood pressure. Those little factors together is the metabolic syndrome. Okay, so black seed oil, this is a randomized clinical trial, 60 patients with that used in, so this black seed oil used in combination with atorvastatin and metformin. So a little bit of cheating because they're using pharmaceutical and allopathic medications as well as that. But you got a decrease in fasting blood sugar, decrease in LDL levels, and total cholesterol that was significantly altered and lowered after 6 weeks of use. No significant effect on body mass index. There was another study that combined just black seed oil, 1.5 grams a day, so that'd be 3 times more what I'm taking, concurrent with turmeric. And we can do a whole nother thing on turmeric and its anti-inflammatory properties. So they had 2 different doses of turmeric, either 900 milligrams or 1.5 grams a day on 250 patients. And that combination, just those 2, so we're talking about black seed oil and turmeric, lowered body mass index and waist circumference after 4 weeks, just 4 weeks of doing that. Combination therapy improved all the parameters, body mass index, hip circumference, blood pressure, total cholesterol levels, triglycerides, and C-reactive protein levels. C-reactive protein is a measurement for inflammation that we kind of do for people who have chronic illness, just to see how much inflammatory change is going on in their body. So after 8 weeks of those treatments, you got reduction in lipids and fasting blood sugar. And then the turmeric reduced CRP. Of course, it was in combination. Sorry. Triglycerides, LDL, and they increased, that combination increased HDL, what everybody calls the good cholesterol, right? Another study on premenopausal women, 12 weeks of 1,600 milligrams a day. helped control weight gain, lipid profile, blood glucose, and actually normalized or helped balance hormone levels. Okay. So that's just, looking at metabolic syndrome. So hypertension, which of course is rampant, it's lifestyle related, potentially, not always. Some people like me, get blood pressure trouble even in their 20s. So dietary modifications are effective in management prevention, right? So intake of black seed oil at 200 and 400 or 400 milligrams a day for 2 months. So this is a prospective study, decreased systolic and diastolic blood pressure in mild high blood pressure as compared with baseline and placebo values. So if somebody was taking something, placebo didn't do anything. So that's that. You keep hearing about this on the news about randomized clinical trials, prospective, double-blinded, placebo, et cetera, et cetera. So what I'm quoting you are studies that have been done in people that have been randomized in their prospective. For obesity, so obesity is defined as a body mass index of 30 square meters per kilogram. So it's based on surface area and weight. So ideally, you have a BMI of 19 to 26. Over 26 to just under 30 is considered overweight, and 30 or higher is considered obese. And of course, obesity puts you at risk for type 2 diabetes and cardiovascular disease, several types of cancers specifically. And what they found was so this is on that 39 guys that had central obesity, showed that 3 grams a day for 3 months of black seed oil reduced body weight and waist circumference, did not reduce serum free testosterone level. And so, anything you do that's accelerating the reduction in testosterone that happens in men most of the time after age 40, they start feeling it. They do reduce testosterone production by about 1 to 3% a year starting at age 30. So they actually looked to see if that was affecting, this little treatment protocol was affecting testosterone levels, and it didn't. However, it did improve systolic and diastolic blood pressure, and it helped with weight loss and body mass index. Okay, with no effect on testosterone levels. And actually, they kind of well, I won't say assumed, but presumed, they kind of thought that black seed oil actually prevented the decrease in serum free testosterone level. It helps, that happens as men age. Okay, dyslipidemia, I talked about that for four different videos about the relationship of LDL, HDL, and total cholesterol levels on heart disease, and specifically mortality from heart disease doesn't appear to be related. However, that study's been done. So people that have elevated total cholesterol, LDL, and triglycerides, or low levels of HDL, can improve those parameters with this 8-week study. So significant decreases after 8 weeks of black seed oil. So decreases in fasting blood cholesterol, LDL, triglycerides, and hemoglobin A1C levels. Okay, so menopausal women tend to have a change in lipid parameters if they get past 50 and they're not on hormone replacement or balancing of estrogen, progesterone. So that's such an, I used to teach to the medical students in 1990 that women that are not on hormone replacement, and it may not just be estrogen. So I'm going back in time almost 30 years. A woman's risk of cardiac death is actually higher than a man's by the time they reached 65 years of age if they haven't done anything to balance their hormones. So this has been studied. I mentioned this earlier on the menopausal study, but basically over 2 months, menopausal women on black seed oil, that was found to decrease the triglyceride and LDL cholesterol levels. as well as total cholesterol levels, and then increase HDL cholesterol levels, the one everybody calls the good one. And remember, the LDL and HDL are little cholesterol taxis. Okay, we talk about that. Okay, so people with stable coronary artery disease, okay, and this is from the World Health Organization, a report on coronary heart disease as a major cause of mortality in the world. It's the leading cause of death in the US still, even after all this stuff we've done to try to reduce heart disease risks. Okay, so examining the effects of black seed oil on the lipid profiles in patients with stable coronary artery disease indicates that 500 milligrams a day for 6 months. This one was done concurrent with a statin at 10 to 20 milligrams a day, decreased the serum levels of all the yucky things that everybody's looking for. Okay, the statin alone, however, did not decrease triglycerides, very low density lipoproteins, LDL, or total cholesterol levels. And I did tell you statins will do that. It's just the fact that a statin does not seem to affect the risk of mortality from heart disease. Okay, so how about diabetes? So that's chronically elevated blood sugar levels, central factor in reactive oxygen species, leading to oxidative stress and inflammation, leading to chronic illness, complications of diabetes, 7th leading cause of death in the US. So here's a report from the Middle East. Black seed oil at 3 grams a day for 12 weeks, caused insignificant decreases in body mass index, insulin level, and insulin resistance. Okay. That sounds like it's not good, but actually when you delve into the actual numbers of the study, those were lowered significantly in an intervention group as compared to placebo group that was taking a supplement that had nothing in it, really. Okay, another clinical trial, 40 days at 700 milligrams, significant reduction of fasting blood sugar and a significant rise of insulin in type 2 diabetes. Okay, if you're constantly stimulating your pancreas and raising your insulin level, eventually you become insulin resistant overall. So the parameters on diabetes seem to improve. If you're, even improve better with people that are taking their glycerides, etc. The question is, will it do it by itself? So there's a table that puts that all up. And sure enough, if you randomized and double-blind placebo control just with 3 grams a day of 12 weeks, that study I just told you about, decreased body mass index, insulin level and insulin resistance was decreased, HDL was increased, fasting blood sugar, triglycerides, and hemoglobin A1C was decreased. Okay, so I'm looking at 1, 2, 3, 4, 5, 6, 7, just that one table is 7 studies showing the same thing, just using black seed oil. So kind of fascinating. Okay, what about the nervous system? Placebo-controlled clinical trial addressing memory and cognition, your ability to think, in healthy elderly volunteers at 500 milligrams twice a day over 9 weeks, improved cognition and thinking ability, memory and attention. Okay, and also even in adolescents. So this was a study where they looked at computed tomographic scans, so CT scans of the brain in healthy adolescent males, establishing that there was modulatory effects on cognition, mood, and anxiety at 500 milligrams of black seed oil a day for 4 weeks. Okay, also has been used and effective in opiate treatment for opioid dependence. So there's some advantages to taking just a simple supplement versus, the opiate treatment that I use is buprenorphine, which is, of course, an opiate itself. So a lot of people would fault the fact that you're treating somebody with opioid dependence with an opiate. The difference being in the pharmacodynamics buprenorphine versus the morphine, poppy-derived oxycodones, and the things that actually fill the receptors at 100%, so much so that if overdose occurs, they quit breathing. So wouldn't it be nice to have something like this that would help with opiate treatment and opioid dependence? So there's some advantages in contrast with opioid treatment, so relieving withdrawal effects, maintaining physiologic parameters, and improving appetites. Analgesic, as far as pain management, and this was kind of interesting because I used to use diclofenac, which came on the market in the late 1980s as Cataflam. Their little marketing tagline was specifically for menstrual cramping. It was 2 cat stat. So you take 100 milligrams, it came in 50 milligram tablets, 2 of them, and then twice a day following that initial 100 milligram loading dose. Well, it turns out that topical, now this one's a topical one, compared to Voltaren gel. Diclofenac comes in Cataflam, and now it's Voltaren. I don't think Cataflam's still on the market, but Voltaren's around. And there is a topical Voltaren gel that people put on their knees for arthritis and knee pain that works very well. This was a study comparing diclofenac with black seed oil in breast pain. Okay, no adverse side effects. So basically applying that oil to a painful area twice a day for 2 months. And that one was specifically on breasts. And that's kind of the only one that I saw. I didn't see one on arthralgia or knees. They allude to that, okay? Dermatologically, this has been used in vitiligo. It's an autoimmune skin disease, destruction of skin melanocytes. So those are the people who have like no melanin in parts of their skin. And so if you compare black seed oil and fish oil to those lesions to a placebo, this was twice a day for 6 months. The black seed oil was more effective than any other treatment on vitiligo lesions. Okay, there was some hand eczema studies, keratosis, etc. Pretty much everything that you look at with this supplement, if it's looked at in a randomized clinical trial, it seems to be helpful. Maybe not curative and not treating, but it does seem to reduce a lot of the problems that lead to more problems as you have chronic illnesses. Okay, infectious disease. This has been used successfully in hepatitis C and HIV patients. Okay. One anecdotal study really was a person that was not able to take an antiviral that is used in HIV, but given no other option, this patient was put on black seed oil at a fairly high dose. So 10 cc's twice a day for 6 months. What I don't know is how much per cc. I'm guessing 500 milligrams. That's a guess. And so that resulted in a reduction of the viral load to undetectable levels in 3 months. So it was a 6-month treatment, alleviation of symptoms and a sustained seroreversal. So that's kind of amazing. So it appears to be virucidal. I'm not even going to mention COVID-19. I got this far into it without even bringing it up. And I'm sure there's no study of any kind looking at black seed oil with that viral load, but there is an antiviral property or a virucidal property. Also been helpful compared to triple therapy for gastric and duodenal ulcers, which are caused by Helicobacter pylori. So H. pylori, Missouri accent, Helicobacter pylori bacteria. Okay, so peptic ulcers, duodenal ulcers, it's pretty high. You know, we used to think it was from all kinds of things that you eat, but it's really a bacterial infection. So the treatment is fairly intense. For about 2 weeks, you're taking 3 antibiotics, or actually 2 antibiotics and omeprazole. So it's clarithromycin, amoxicillin, and omeprazole as well as something to coat the stomach, like Pepto-Bismol or milk of magnesia. But if you treat this with 2 grams a day of black seed oil, you get the same result as doing that triple therapy thing. So theoretically, I guess if you just took it once a day, you might be able to head off having a bacterial infection in your stomach, which is pretty, it's pretty common. You can die from a peptic ulcer, especially if they bleed. Okay, reproductive system. So this is a study in Iranian men that were infertile, so low sperm counts technically. 2.5 cc's of oil twice a day for 2 months compared to a placebo. They got an improvement in sperm parameters, sperm count, motility, and morphology, semen volume, pH, and then effects on the Leydig cells and reproductive organs and sexual hormones in infertile men have been confirmed. So actually a raise in testosterone level and Leydig cell function in the testicle. As far as lower respiratory tract illnesses, this has been shown to have anti-asthmatic effects at 50 and 100 milligrams per kilogram. And compared to people, theophylline is better at pulmonary function studies in the end of that study. So compared to theophylline, pulmonary function studies are not as good as theophylline in black seed oil administration. But they did show that there was bronchodilatory effects in asthmatics. Okay, so the 2 treatments that are used, the 2 treatments they used was theophylline, which is pretty standard, and salbutamol. Those improved pulmonary function tests, but there was symptom reduction from bronchospasm and asthma with patients taking black seed oil. The GI system, they specifically looked at celiac disease, so that's an increased sensitivity to gluten, and inflammation and destruction of the mucosa in the small intestine from an autoimmune mechanism. Okay, so there was a study where they prescribed a gluten-free diet together with consumption of 450 milligrams of black seed oil capsules twice a day, and then that was for 1 year, and that was found to be more effective than just the gluten-free diet alone. And this was treatment of patients with iron deficiency anemia associated with refractory celiac disease. Okay, so the duodenal, and they looked at duodenal histology, that seemed to have recovered. So they actually did little biopsies and looked at them, a year later, and they had improved. Okay, so this is kind of interesting when you look at all the things. I mean, I can't think of any other supplement that I've ever run across that has that much study and that much randomized prospective clinical trials done in not the United States, but in the Middle East and in India. And, something that's been touted for over 2,000 years just as folklore and what everybody says is anecdotal evidence. So this particular study I'm looking at is from 2017 in a pharmacology journal from not the United States. The active constituent of black seed oil is thymoquinone, and that's what they kind of look at in all these studies. And I could read you all this other stuff or go over all this other stuff as far as all the chemistry and biochemistry involved, but that would be probably even horrifyingly boring. But basically, we're looking at a supplement that's fairly inexpensive. I think my bottle was 60 of these 500 milligram black seed oil. That was, I think, $22 for 60 of them. I guess I take one a day. If you were working on something inflammatory or pain wise or whatever, they had quite a bit higher doses, but just for general well-being, 500 milligrams a day or 1,000 milligrams a day seems to be the way to do it. So effective in prospective studies in different chronic illnesses, neurologic, mental, cardiovascular, cancer, diabetes, inflammatory conditions, and infertility, antibacterial, antifungal, antiparasitic, antiviral. So the push on these two articles is, hey, why don't we just look at this in even more detail in even bigger populations? Okay, so because it's a plant-based thing, and the World Health Organization talks about the fact that in 60% of the world, the only thing they really have for therapy is plants. You know, aspirin comes from a plant. There's plenty of medications that have been that we take all the time that are plant-based. They're not synthetic, and so a plant-based supplement that potentially is helpful on all those parameters is probably a reasonable thing to study. Probably not going to happen in the U.S., but what I'm telling you is in these two papers that I'm looking at that was published in PubMed or the NIH, I'm looking at over almost 300 studies that were prospective, some of them done in animals, some of them done in people, and some of them comparing traditional synthetic medications for these things with just the black seed oil administration. So I'm glad that Jim Booth told me about this. He lives in Florida. He's like, this is the thing to take. And so I started looking at it. So I spent about 4 weeks kind of reading different stuff before I did this one. So it's a fascinating little supplement. It's inexpensive. I'm not saying it'll treat you or cure you, but it's probably worth a look-see and a little bit more information. So I will set up, I'll show you where to get it. I'll put it in the comments when I get done. And then if you want to try it, give it a shot and see what you think. It doesn't make you feel anything. I've been taking it for about 3 weeks. I'm not going to say that I feel anything necessarily. But if it does all that stuff, what the heck, right? Okay, so I'll see you Monday. Have a great weekend. It's very nice outside finally. And hopefully everybody has a restful weekend, and I'll see you Monday at 9:30. And I'll come up with something else, hopefully cool to talk about. See you. Bye.